So this is a lecture for the nervous system, or chapter 10 in medical terminology. Opening up your textbooks and following along with me, there's a great introduction. You can read that on your own. Really talking about the general structure of the nervous system, that next kind of blue heading is really splitting out between understanding what is the central nervous system and what is the peripheral nervous system. And I look at that picture on the very next page, and there's a little bit of different color here. It's not as drastic as really it should be, but you see the brain and the spinal cord, and they're more of a darker pink color. And then you see all of these nerves or plexuses coming off, and they're more of a yellow color. I have right next to that guy in that picture, kind of written in my textbook, I wrote central. And underneath central, I put brain and spinal cord. Okay, that's the central nervous system. Anything having to deal with the brain and the spinal cord. The peripheral nervous system is like everything else. It's the cranial, the spinal, all of the peripheral plexuses, okay? And if you flip back to that very first page towards the bottom, a plexus, there's a watch box there, and it is a bold term. It says, is a large network of nerves in the peripheral nervous system. So the brain and spinal cord is your central nervous system. Anything else that goes out or further away to the farther edges of the body is your peripheral nervous system, and that's how you can keep those straight. Turning the page, we have a really good picture of the cranial nerves. Okay, the cranial nerves listed here, number 1 is smell, and then it goes through 2 is vision, all the way through 12. And I have in little quotes here, you see a lot in medical reports, cranial nerves 2 through 12 intact, excuse me. You hear the doctors say that a lot, cranial nerves 2 through 12 intact. And that's what they're talking about here, is this page with our nervous system. At the very bottom of that page, some really good bold terms here to make sure you understand the difference. Sympathetic and parasympathetic, and what's the difference, okay, between these types of nerves. I have written in my book, sympathetic, you see the word sympathy, right? In that paragraph, it says sympathetic nerves stimulate the body in times of stress and crisis. So we're getting worked up, okay? That's sympathetic nerves that do that. Parasympathetic nerves are more balanced. Okay? They calm us back down. They bring us back to normal. Okay? So it's important to know the difference between those two types. A neuron is listed next. There's labeling you can do if you want. I do like over on the next page, across from the neuron, almost smack dab in the middle of the page, is a paragraph that starts with, neurons and nerves are the parenchyma, we talked about this a chapter or two ago, of the nervous system. The parenchyma, again, is the essential distinguishing tissue of an organ. Okay, so neurons and nerves are the parenchyma, the most important. Okay, the distinguishing tissue of the nervous system. On the next page, when we talk about the brain, I have a couple of terms kind of highlighted here. The gyri, okay, and the sulci, so read about those. Again, this is more anatomy and physiology stuff that we kind of can skip over, hit the kind of highlights. If we turn the page under spinal cord, again, you can pause me and you know, move me as you need to keep up with me. The gray matter and the white matter. Okay, understanding the differences between those is going to be good for you. And then we get to the vocabulary, where you can go through, make sure you can say all of these terms and understand all of these terms. Pay attention to the plurals. There's quite a few plurals here, and how to make them. That brings us to our blue boxes. First, we start with organs and structures. So we have cerebello, cerebro, duro, encephalo, glio, lepto, meningio or meningio, myo, myelo, neuro, ponto, radiculo, thalamo, theco, and vago or vago. Under myelin, there's a watch box there. But under the term, they use poliomyelitis. Polio, it says, means gray matter. I wish they had that on their own. Okay, that's kind of a good spot to highlight as well. And under neuro, with nerve, neuropathy, there's a YouTube video that you can watch that's really good out there for peripheral neuropathy that I have for you in the content. If you keep going on, we have algia, causo, comato, anesthesio, anesthesia. So as a combining form and as a suffix, you see the differences there. Look at kineso, kinesio, kinesia, kinesis, and kinetic. That all deals with movement. Anytime you see that K-I-N, okay, it has something to do with movement. Paresis, phasia, and plesia. Okay, now go back to phasia. We learned a while back, phasia with a G, and here's phasia with an S, and they both sound exactly the same. So here where we're at in the chapter, P-H-A-S-I-A, phasia means speech. S is for the speech. Okay. We talked about in the digestive system, phasia, sounds exactly the same, but it's spelled with a G, P-H-A-G-I-A. That has to deal with swallowing. Okay, so phasia with a G is swallowing, phasia with an S is for speech. Okay, note the difference. Those are super, super close. Pay attention to those. The plesias, praxia, sthenia, syncopo, and taxo are listed there. Spina bifida is a good one for you to pay attention to and read about. Alzheimer's disease, another good one when we get into disorders here. Seizures, when you get over to epilepsy, there's a lot of reading there to do regarding epilepsy. Some of the bold terms that I have highlighted are aura. Okay, that's good to know what an aura is. Petite mal, okay, and post-icto. Okay, make sure you read through those so you can understand those bold terms. Over under Parkinson's disease is a good P word for us that I don't know if we've come across yet, and if we have, it's good review. The word palliative. Okay, palliative care. P-A-L-L-I-A-T-I-V-E, palliative. Palliative care, and in parentheses there it says relieves symptoms, but it's not curative. So if we give palliative care, we often think about giving that palliative care to someone in hospice. We're trying to keep them comfortable. There's nothing more we can do. In hospice care, you usually have 6 months, 3 to 6 months or less to live. Okay? Palliative care is making the patient comfortable. We're not trying to cure them because we've tried and we can't. Okay? So palliative care is a good word to know what the definition is. If you turn the page, knowing the definition is really good between a concussion and a contusion. Okay? A concussion says it's a traumatic brain injury or a TBI caused by a blow to the head. A contusion is a bruising. Contusion is the lesser. Okay, the lesser of the two. A contusion and a bruise can happen. I don't want to say easy, but a little easier. Not as dramatic, maybe, or traumatic as a concussion. Okay. And then I want you to know the difference as well between what's listed next here on the same page, CVAs and TIAs. So CVAs, you see cerebral vascular accident, okay, under vascular disorders there in your textbook. TIAs are a bold term listed at the very end. It's the last words on the page here before the pictures. Transient ischemic attacks. TIAs are the lesser of the two here. Okay, if a patient has a TIA, transient means it comes and goes. They might have a stroke. Okay, if all of their symptoms are gone and they are back to normal afterwards, they had a TIA. The patient has a stroke. They don't go back to normal. They might have the slight drooping or an issue with their walk or a movement from one side of their body. okay, that they can't do as well anymore because they had a stroke. They have a residual effect somehow, okay? It's not going to go away. It's there, and it's there forever. That's a CVA, a cerebrovascular accident, okay? That's more intense. So know the difference between those two as well. Another big one for spelling is on the next page in that kind of pink or purplish color study section. The word aneurysm. A lot of people misspell that word, but know that we have neuron or okay, in there. A-N-E-U-R-Y-S-M, aneurysm. Make sure you know how to spell that. The next we go through some of the techniques and procedures. There's also a gamma knife for stereotactic radiosurgery. There's a gamma knife video that you can watch from YouTube as well. Otherwise, abbreviations, again, we kind of went through the CVA and the TIA. Those are the most common ones. And then that's the end of the chapter.